this, let's talk about something almost every human experience but don't feel comfortable talking about it, which is vaginal discharge. That discharge on your underwear, have you ever seen it and thought about, why is it slippery today? Why is it thick? Why is it white? Or do I have an infection? Do not panic, you are going to know after some minutes. Welcome, and I'm going to tell you about your vaginal discharge, when the changes is going to call for medical attention and when it's normal. This vaginal discharge, it changes during our menstrual cycle. When you're ovulating, you are supposed or expected to experience a slippery white vaginal discharge. Just like a raw egg white, it's going to be slippery that way. But when you are experiencing vaginal discharge whereby you are seeing a thick yellow mucus, this mucus is not healthy. It's an indication that something is wrong. What are the mucus we're even talking about? The mucus, this is what the vagina and cervix produce to keep the vagina clean and moving. Okay, we say that the vagina is self-cleaning, right? It's quite alright. That's why you don't need to dutch. You don't need to dutch. Dutching means some people, if they are having their bath or they are washing their vagina, they tend to put their hands inside to wash. No, that's what we call dutching. By so doing, you are introducing bacteria into your vagina, which is not healthy. You are just expected to wash only the outer genitalia of your vagina. You're not supposed to put your hands inside because the vagina already, the way it's being created, it's self-cleaning. And these discharges are an indication of what is really going on there. Normally, people say, I have normal vaginal discharge. It's not normal. Nobody has a normal vaginal discharge. Yes, you're supposed to have few discharges sometimes, but not during all the cycle, because we have different phases in our menstrual cycle, which we talked about earlier. Ovulation, when you are seeing that white slippery egg white discharge, that means you are ovulating. This is a sign of ovulation. Some people experience it, while some people does not. That means if you are not experiencing it, that means you are not ovulating. Also, if the discharge is thick and creamy, is also an indication of you are in your luteal phase. This luteal phase means that the body is preparing itself for menstruation to occur. And also in another phase, which is what the proliferative phase. In the proliferative phase, that means egg is trying to reproduce. The egg is trying to produce itself in the ovary. At that phase, you are not going to see any discharge. But if you are experiencing discharge all through the months, that's not a good sign. There are some days you are not supposed to see any discharge. And also, the consistency, the color, the amount of the discharge is very, very important. That's what you have to watch out for. So don't panic whenever you are having any. But if you are having a smelly discharge, you're having a thick discharge that is yellowish, or it has another kind of color, or gray, that is showing like a sign of infection. If the discharge is now more like cheesy, like it's clotted or something, that means you're having yeast infection, which is something that you have to go to the hospital for, and it's going to call for a quick medical attention, and you have to take care of your body. Remember, as a woman, your discharge is an indication of what is really going on. So take care of your body today and be well.